representatives from all of the delegations today, the acting DG, staff, media, and anyone from the public. Welcome to this Portfolio Committee meeting of Public Service and Administration on the 5th of August. I hope everybody have had a refreshing and energizing break, combined with all of the different constituency work and political work that I know my colleagues have all been busy with as well. It is an election year, so there is lots of political work that also needs to be done. But here we are. We also have obligations as members of Parliament and as members of this committee. So I do appreciate that all of the different members are signed in today. Committee Secretary, can we please project the agenda so that we can just adopt the agenda for the day? There we have it, members. The agenda, as you can see, it is on the screen. We are scheduled to start at 10 o'clock. We are scheduled to adjourn at 1 o'clock today. We will have the main item on today's agenda is the update on the review of the public service regulations and the public administration management regulations and the impact of the CPSI innovation projects on service delivery. Then we will have an opportunity for deliberations and have some draft minutes to consider at the end of the meeting. Members, may I please see a mover and a seconder for the adoption of this agenda?
Chairperson.
Yes, Honorable Ntolu, I see your hand, and Honorable Kaba.
Greetings, Chairperson and members of the committee. I move for the adoption of agenda.
Thank you very much. Honorable Member, Honorable
Good
Kaba.
morning. Good morning, Honorable Chairperson and all members in the platform. All protocol is observed. I rise to second the adoption.
Thank you very much, members. That is much appreciated. The agenda is therefore duly adopted, and we can proceed with the rest of the agenda. Members, that brings us to our second point on the agenda, which is the apologies. We have received a written apology from the Deputy Minister. Honorable Langa has indicated that he might be slightly late, but that he will be joining us today. I myself have to excuse myself at 12 o'clock, but I have arranged with Honorable Kaba that she will take over the chairperson's position and chair for me at 12 o'clock today until 1 o'clock when the committee is scheduled to finish. It should just be the last part of the deliberations. And as backup, Honorable Speaker said that if something goes wrong, if Honorable Kaba should lose service or something, then she's willing to also back up. So just from my side, Honorable Kaba, thank you very much that you are willing to chair the meeting from 12 o'clock to 1 o'clock. Members, is there any other apologies that need to be noted? I see no other hands. So then, Acting DG, I see your hand. Would you like to note an apology?
Thank you very much, Honorable Chair and members on the call. Yes, my minister's he's trying to connect. I think his network is failing him, but anytime he'll join the meeting, he's trying to connect. Thank you very much, Chair.
Thank you so much, Acting DG. Please feel free to maybe just let me know if he has joined, that we can just also give him an opportunity for some remarks, should he so wish. Honorable Ndamase, I see your hand.
Good morning, Chair. Good morning to the honorable members and the meeting at large. I am double booked, Chair. We have a meeting with COGTA that started at 8. I'm between the two meetings, Chair. Thank you.
Thank you. Noted, Honorable Ndamase. Then I see a hand from a Alpha's iPhone, so I'm not sure who exactly that is, but perhaps you can just identify yourself, please.
Thank you, Chair. It's Minister Buthelezi. I'm sorry that I didn't change. this gadget I'm using, yes. I indicated that I'm really struggling with connectivity, but I've managed so far. But it's not
Okay.
very, very stable in case I'm lost. Thank you, Chair.
Thank you, Minister. You are most welcome. I will give you an opportunity to just make some remarks after I've done my opening remarks. But thank you for joining us. It is appreciated. Members, with the apologies then done, we can move on to my remarks. Members, on March 2026, the President signed the Public Administration Management Amendment Act and the Public Service Amendment Act into law. The legislation was subsequently gazetted and came into effect in April of 2026. These legislative reforms aim to strengthen accountability and improve efficiency by devolving administrative powers from political executives to heads of departments. There is a need to move swiftly to develop detailed regulations to guide the implementation of these two pieces of legislation. And while the development of regulations is the responsibility of the Minister, it is also Parliament's constitutional oversight responsibility to monitor the progress and to ensure that the legislative intent is realized through timely implementation. We are looking forward to receiving an update on the progress made in reviewing and developing regulations to align with the amended acts. The committee has also invited the Centre for Public Service Innovation, or the CPSI, to brief members on the impact of its innovative projects on service delivery. Innovation remains a critical enabler of a capable, ethical, and developmental state, and the committee is particularly interested in understanding how these initiatives contribute to improve the quality, accessibility, and efficiency of public services, while enhancing value for money and reducing the cost of service delivery. But with those few words, I will now invite Minister Buthelezi to just deliver his opening remarks as well, whereafter we can move for the presenter to take the committee through the presentation. Minister Buthelezi, please proceed.
Thank you, Chairperson, and good morning to your good self and members. I don't think I've got much to say, Chairperson, except to appreciate the opportunity, because it's always a pleasure to appear before your committee and to account. I only hope that the team, through their presentation, will update the committee as to how far are we in relation to the two items, in particular the amendments that was signed by the President, the Act, in fact. I think this process that we have started to engage as the department of now formulating legislation, the legislation that will guide the whole process, this is a very critical moment, because it does not necessarily only guide the implementation of the Act, but also it bridges any gaps that may be identified in as far as how the implementation process itself should unfold. And I also want to say to the committee that we appreciate the fact that there has been some delay, because this work should have been concluded by now, because we have known about this even before the President signed the acts. We're supposed to put our ducks in a row to make sure that by the time the President signs, it doesn't take us much of time to come up with legislation that will guide the process. But what I want to overemphasize is that, among others, we have experienced some capacity constraints inside the department in as far as this whole process is concerned. As a result, the presentation will also indicate that we have considered to use external service providers to assist us, because there's been the capacity issue, which we were not very much taking cognizant of it up until now, because some of the individuals that were dealing directly with this work have left the department, so that have left a void therefore. But we appreciate the contributions by the members so that they can even enhance this process as we start to finalize. Thank you, Chair.
Thank you very much, Honourable Minister. I think your last sentence just got cut off on my side. I'm not sure if it was just my device, but I think I heard 99% of what you said. So thank you very much for that. We look forward to the presentation. Members, with the opening remarks by the Minister done, it is, I think it's good that we move on to the next agenda item, item number 3, update on the review of the public service regulations and also the impact of the CPSI innovation projects. I will first hand over to the DPSA to please take us through the presentation. Thank you. Please proceed.
Thank you very much, Honorable Chair, and thanks very much, Minister, my Minister in course. So I do have my colleague, Advocate Maschaba Matlo, to make that presentations. But to underline what Minister said, indeed, we lost 3 officials in that area of work. These are technical skills that we require. So, but we're making a lot of progress. You will see in our presentation. I'm sure when we come back next time, we'll give the draft regulation as part of the information. So, Maschaba, please, can you flag the presentations and take members through? Thank you very much.
Chair, is it only me or is there a problem with the...
No, we are still patiently waiting, Honorable Space.
Okay.
Acting DG, as the member has indicated, we don't see anything yet.
Honorable member, the member is on the call. I think she's trying to unmute in her gadget, but she's in the call. She's unmuting. She's trying to unmute. This gadget thing sometimes a problem, but she's on the call. Let me check her again for a second time.
Okay, no, we will wait with patience, no problem. Acting DG, should there be a technical issue on your side, we can also ask the CPSI to do their presentation first, and then you go after that, should that be necessary, just as an option.
Yes, Honorable Chair, you may start with CPSI. Let's deal with the technical problem. We'll come back. Thank you very much.
CPSI, would you be, Mr. Skoenraad, would you be, okay, yeah, I see you are ready, as one would expect from the CPSI. So thank you very much. You are most welcome to proceed with your presentation.
Good morning, Honorable Chair. Good morning, Minister, and good morning, members and colleagues. I just want to check if I'm audible.
Yes, 100% honorable. 100% audible. You are most welcome to proceed.
Thank you very much, Chair. And I just want to confirm that my slides are visible as well. Chair, thank you very much for the opportunity. I am joined with my colleagues in EXCO, as well as some of the other colleagues in the organization responsible for research and for performance monitoring. We will take you through a couple of slides. In our meeting with Minister, he also indicated that it would be valuable for us to also provide the Portfolio Committee with a narrative report due to the time constraints as well as the challenges of the slides just having a snapshot. So we have shared with the Secretariat 2 additional documents that members can refer to in terms of more detail of the work of the CPSI. We'll just provide you with some background context around impact assessment, as well as then continue to provide you with a number of examples of the impact of the work of the CPSI over the last 5 years in terms of the service delivery impact that we have seen. And then also I'm sure the members would like to engage then on how do we improve and maximize impact, and we will share a few thoughts on that. Chair, I'm not going to go into detail in terms of the mandate of the CPSI. Members are well aware of the work of the CPSI. This slide is merely to just give the context in terms of which areas are we looking at when we look at impact. Secondly, Chair, and I think it's very important to state that the work of the CPSI mostly achieve indirect longer-term impact. When one look at the work of innovation facilities, much of the work, including research, knowledge sharing, experimentation, and learning, do not necessarily immediately and directly translate into impact, and it should be then viewed as investment. There's been quite a lot of work done by Stanford social innovation, as well as the UN entities in terms of unpacking and understanding the focus of innovation facilities. We do, however, are able to share direct impacts that the CPSI and partners have achieved through work specifically around replication. And then lastly, we will also focus on some of the indirect impacts, which is mainly experienced by departments and institutions that are supported. As such, there is also a need for...
Mr. Skoenraad?
Chair?
Apologies, your screen on our side, your screen is just black. Your presentation, we could see your slides, and then when you went over into presentation mode, it just turned black. So we are unable to see the presentation at the moment.
Apologies, Chair. Let me just reshare. Let me just... Chair, is it now visible?
Yes, it is now visible. Thank you.
Sometimes it goes to the wrong screen. My apologies. Thank you. Chair, as I've indicated, if we look at innovation cycles, much of the work is on the investment side rather than on the impact side, with the impacts then achieved within departments and within institutions that in many cases lies outside of the control of the CPSI. In other words, what we will be sharing is in terms of the work, specifically in terms of the replication work, and then also indicate how the broader program contributes to impact. This is just a summary then of the various activities in terms of the notice of the CPSI, and the highlighted area specifically around solution development, replication, and scaling is where we can then engage further on impact. The last contextual slide that we would like to share, Honourable Chair, is that when we talk about impact, there are various facets of innovation, and therefore one need to unpack the impact and the impactful events in terms of these facets. If one look at this depiction by the OECD, when one talk about enhancement-oriented, enhancement type of innovation, obviously it would be a gradual change that we can report on. or adaptive would be something new that we've brought into the public service that may not previously have a baseline. Mission-oriented innovation obviously is more on systems level, and therefore the impacts are also more in terms of system change, whilst anticipatory innovation, the impact will only be seen much later and much further into the future. Chair, just to give you a snapshot of the presentation with a few numbers that we will go into detail during the presentation. At the top, we have 63, which is the average number of minutes saved per patient of our Innovator of the Year to 2024 at the Edenvale Outpatients Pharmacy, which has now been also replicated across hospitals in Gauteng. 120 million is an estimated number of the amount that we have saved government departments in terms of the rollout of in-house developed solutions. And if they were to go to the market, we are estimating that this would be the cost for department. 18,000 is the number of youth that we have reached through our partnerships in terms of digital skills development. The 184, and I must apologize, we've updated this number after consultation with the implementers, is the millions of liters saved just in one hospital through the implementation of an innovation. And we see an average number of about 80 innovations coming through per year. 120 is the number of systems developers that we are now placed in a community of practice for sharing and exchanging development, and 84 is the percentage of unidentified bodies reduced, unclaimed unidentified bodies reduced in the province of Gauteng through the innovation. Chair, I'm not going to read this slide, but I would encourage members to just read the narrative, the story of some of the innovations that closes the loop between the capacity building and the eventual innovations that are happening in government. We have shared this in the narrative report as well, but it's very important for us that there's an understanding of our theory of change and the value add that we are introducing through the various platforms that eventually then translate to innovations within government facilities. In this case, the pharmacy that I just referred to, that were able to save each patient an average of 63 minutes. That's an hour and 3 minutes reduction in waiting time. Talking about this solution, I'm going to go into a couple of examples. When we engaged in design thinking training for public servants, we challenged them to look at very critical challenges in their environment and then leverage the tools that we train them with to change at least one small system within their control. And this has happened in Edenvale Hospital, where they leverage then design thinking and lean management principles to reduce waiting time from 75 minutes down to 9 minutes. And they are setting themselves a new target of 5 minutes. It's very important to note that the nature of the outpatient clinic is where patient at the end of a long day in the hospital will spend time waiting after they've seen a specialist, after they've seen a doctor, and then come to collect their medication. So dissatisfaction is quite high, and this was what the team wanted to address. The team was able to then reduce this waiting time that was longer than the entire patient journey in the hospital, down to the 9 minutes as stated. CPSI, through working very closely with this team, was able to assist them with further innovations, such as smart lockers to reduce the time further, and it's now in 8 other Gauteng and 4 Limpopo facilities. So one can then see the cumulative effect of this very simple intervention that had minimum cost to the team. Very important also to note the radical change in the quality of experience of public servants themselves. A project that we've already presented to the portfolio committee, but here we are just unpacking some of the savings, is the digital forensic digital fingerprint, where there has been a significant number of unclaimed deceased in mortuaries in government. In Gauteng, it stood over 1,100, and in provinces such as KZN, 1,500 and above. Through this project, which was in collaboration with the CSIR, the project was initiated. However, the cost of the CSIR solution was estimated at around 3 million per solution. Through experimentation engagement at the coalface, this solution was eventually reduced to a simple laptop and a fingerprint screen or scanner, apologies, and then also some software in order to connect to the Department of Home Affairs and to our credit bureaus, bringing the cost of the solution down to 25,000. One can see then the significant impact. A second area of concern was that the translation of this challenge into pauper burials at an average cost of around 3,000 rand per burial. One can see that in 1 year, Gauteng was able to reduce this through this solution from 938 to 176, and that means a saving of at least 2.2 million for the province. We were able to then replicate it to other Gauteng facilities and one facility in Limpopo, and what we did was just providing these laptops and scanners as seed equipment for the project to start for, and then the provinces could take it further. What's very important for us here is not the numbers in terms of the millions saved, the number of unidentified bodies removed from our mortuaries, but the fact that it brings closure to families, that it restores dignity, and it brings healing to families. And that is the important part for us about this project. We are continuing to support the further replication of this, also to look at the identification of unidentified patients, even though there are challenges around the POPI Act. But the team is supporting. So when we are talking about institutional support, this is the activities that the team is now doing. Honorable Chair, in a previous meeting, we started talking about leveraging in-house developed solutions. In this case, one of the solutions entered for the Public Sector Innovation Awards was the Eastern Cape Office of the Premier, a solution that they developed way back in 2017. But because of the moratorium placed on the development of solutions because of the anticipated IFMS, this work could not proceed. However, we were now able to start sharing source code, and we are looking at implementing this across various government departments. We've already implemented it within a 2-month period for the province of Mpumalanga, where it's now active in both the office of the Premier as well as 7 other departments, and 390 posts has already been advertised. In the narrative report, we are sharing some calculations in terms of the savings to citizens. We estimate that this initiative has saved citizens already over R500,000. If we look at the cost of scanning, copying CVs, traveling to submit this physically to departments. We also need to note the very important part that there are no licensing costs involved, and that there's a community of practice that continuously update and bring significant enhancements. We are now past about 35 enhancements to the system from the original one from the Eastern Cape, and this is continuous work. Also very important, this committee has asked more than once around the time it takes to fill vacancies. One of the key factors is that after posts have been advertised and CVs submitted, it takes 3 months or sometimes even more for HR officials to simply compile a master list from where shortlisting can proceed. With the system, the master list is generated immediately at the closing of the advert. It also prevents any human intervention, so no one can slip a CV into a process if people have not legitimately applied for the job. The team is currently busy with the Office of the Chief Justice, and we have a number of other departments that we are working with. This project for us demonstrates the capability of public servants being able to develop solutions, and therefore we can reinvest ICT spending into critical areas such as cybersecurity. Last year, Minister also handed over, earlier this year, handed over a solution called the Smart Agricultural Box. We've also previously reported on this initiative. Very important, talking to the priority of reducing poverty in communities. Again, this project is one of the projects that came through the awards from the Mpumalanga Department of Agriculture, and an active participant in the Innovation Awards. And we can see how participation in the awards program then stimulate further innovation in departments. This smart modular box in itself is not the innovation, but the way that it is used to as a reservoir for water and linked to a smart mobile app where the process can be monitored and the water levels and the hydration levels can be monitored. Mpumalanga was able to roll this out to cover 7,000 vulnerable citizens, and we've calculated that per box, the benefit to citizens in this regard, in terms of either income generation or savings from procuring, is in a season around 880 Rand, depending on obviously the market and the cost of vegetables. But it provides for variety, it provides for better nutrition, because harvesting is within 3 weeks and there are about 5 harvests per season, bringing further food security. This was also a Continental Award winner with quite a lot of interest across the continent, so the impact is now also felt in the broader SADC region. We were able to replicate this in the Department of Correctional Services, where it found a new impact, and that is to deal with offender rehabilitation and reducing the cost of procuring food. And a Free State municipality was also interested and we were able to then support them in total between the two facilities with about 200 boxes. So we can see the impacts being significant, and with further replication to provinces as a solution to deal extensively with food security and small business development. Chair, another solution that came through and demonstrate how facilities experiment and adapt solutions. The Brosolo tape is not a new solution. It was developed in the 1980s already, but there are significant challenges in terms of applying it in a more less affluent communities and communities under severe stress. So it was adapted originally at the Mitchells Plain Community Health Center, allowing for rapid response to resuscitate children under 5 years old. The picture there is not very clear, but in essence, it is a color-coded tape that uses the length of an infant to approximate the weight and therefore the specific dosages and procedure. We have seen in terms of the impact that this is saving during resuscitation an average of about 4 minutes. 4 minutes may not sound a lot, but is the difference between life and death, and it is the difference between full recovery and perhaps severe consequences such as oxygen starvation and so forth. Very important for us from a public service perspective is the levels of anxiety for staff when you need to resuscitate a child. I think no person in this meeting would ever want to be in that environment. And what this has done was to assist with basically in a practical way, in a systematic way, assist staff to address this. We have trained staff, and the picture there is part of a training session from 25 clinics in the city of Tshwane, 3 hospitals in Gauteng, and provided 35 kits in terms of the further replication. In essence, clinics and hospital facilities can now take this further. Another project that may be a small project that came through our awards program and that we were able to further replicate across the whole Free State, and also are introducing it in other provinces, is a global initiative around green and healthy hospitals, where we optimize environmental management in hospitals. The water and electricity savings are significant, but very importantly, the safe disposal of medical waste. We see various reports around medical waste finding its way in our water system, having all sorts of negative effects. Importantly, where this started as a humble project, we were able to help develop a mobile application for real-time audits in hospitals, and also deployed 15 tablets across hospitals in the Free State where this can be used. In the slide with the infographic on numbers, I mentioned the number 185 million. One of the other hospitals, Groote Schuur Hospital around the corner there from members, were able to use this initiative to start a water saving project and a recovery project of steam used in the hospital. They became our 2023 Innovators of the Year. And through this process, they were able to save 1 million liters per week. I'm going to repeat that number again because it is quite a significant number. 1 million liters per week at the hospital. And since the inception of that project, 185 184 estimated million liters saved by the hospital. This has been replicated in 3 hospitals already in the Western Cape, as well as 2 private hospitals, looking at the knock-on effect. Honorable members, I think the third last or this last project, and then I will move on to our other programs that I would like to share, is again a project that started as a humble court monitoring process by our community safety departments in the provinces. The Western Cape Community Safety and Policing Oversight had one official that started looking at consolidating information. And this project is of importance for us because what happened was that the department looked at tools that they already had. Through their Microsoft licensing, they had access to Microsoft Forms, they had access to generate QR codes. So they were slowly busy converting it, and CPSI then facilitated this process to convert this initiative into smart forms. In essence, we have monitors in our courts, and we have seen from recent development how important it is to look at dockets that are not arriving in court, where investigations are incomplete or delayed, or where dockets were lost, and to monitor this in real time so that community safety departments can provide that civilian oversight and make sure that if there's a problem, if there's corruption, if there is poor performance, that it is immediately addressed. What is now possible is that we are able to do this in real time, and the dashboards are then compiled. And this project has now been replicated from the Western Cape to Northwest, Eastern Cape, and Northern Cape. And the team is also busy then further replicating. What is very important here is that we now have data to base interventions on, and this can then be displayed on a day-to-day basis through the use of a simple cell phone and a free form. Chair, over the years we have seen a number of initiatives coming through that have on their own had quite a significant impact on the public service and on service delivery. And through the awards program, through the knowledge sharing program, we are then building a culture where public servants are encouraged to innovate. Many of the names that you see there, e-filing, BIS portal, the chronic dispensation of medication, digital transformation journey, saving blood, saving lives, are projects that came through the awards and then were over the years supported and had a significant impact. For us, the beauty lies in officials innovating themselves, not needing the CPSI, and that's why we have the various platforms. It's unfortunately not possible for us to indicate what the impact of these initiatives were through the innovations that were brought to the public service, but we know from BIS portal and the subsequent projects that were submitted, the registration of a business was reduced from 2 weeks to 3 months, down to less than an hour. In terms of the digital transformation journey, this is now a provincial initiative where provincial CIOs across all provinces are engaging in terms of implementing this and also then share solutions. To conclude, Honorable Chair, our learning program has been running for through the conference 19 years, the awards program 23 years, our innovation training and later design thinking training for the last 5 years. And we are seeing the results now, for example, on the design thinking training coming through. We are seeing the results. We are now in the 3rd year of our DEFCON, where public servants actively work together. And we have shared a number of case studies in the supportive documents. And I would also urge members to look at our knowledge repository, where we have a growing number of solutions being posted, currently standing at 43. Lastly, Chair, our Youth Digital Skills Development Program is also seeing quite significant impact. And what we are appreciating is the mutual learning that is taking place. Through a conversation with our youth partners, we initiated the DEFCON, which is now the primary platform for systems developers in government. And we have what we call reverse mentoring, where our youth are also then influencing public servants in terms of actively responding to the initiatives and the needs of youth. And we hope to see through this program, we already have employed 2 developers that came through this program. We also hope to see more public servants coming in. Chair, we can do only so much in terms of supporting replication. Our replication consists of 3 staff. Our developer team consists of 3 staff members. And many of these projects that I've just shared are in need for further scaling, further support. But it's impossible for the team to do that if they are not able to further project manage because of new demands. We annually see more than 60 projects through our awards program amongst the entries that are possible projects for replication. So we need to develop a more portfolio approach. We are strengthening partnerships, for example, with provinces, leveraging the interprovincial coordination. But importantly, we also need funding for experimentation and sandboxing. Chair, with additional capacity, and we're not talking about significant capacity, but building agile teams, we would be able to provide further support in terms of the replication of solutions, and annually then select 2 more projects for replication going forward. Chair, that brings us to the end of the presentation. Thank you very much.
Thank you very much indeed, Mr. Skoenraad. It is really nice to see such a positive presentation. Lots of innovation in it, and I'm sure members will enjoy deliberating on it at the end. But now we hand over to the TPSA for their presentation. TPSA, please proceed. Your presentation is visible.
Thank you, Chair. Good morning to you and good morning to the members in the meeting. Good morning to the Minister as well as the colleagues in the platform. Thank you, Chair. Due to the numerous inquiries by departments, a circular was developed for the DG signature, and it will be issued informing them the next steps that will be taken to bring the Amendment Acts into operation. The DG directed the legal services together with a task team formally nominated by the DG to be involved in the drafting of the regulations. The task team developed a process map setting out timelines to guide the process of developing the regulations. And a table was also sent out to the branches of the and units within the department to give input on amendments that are related to the Amendment Act, as well as any other amendments that might be emanating from policy, so that they can be processed together. These inputs were received from the branches and the units. As already indicated by the Minister as well as the acting DG, legal services is not fully capacitated to deal with the drafting of the regulations at the moment, and as well as the consideration that the PAMA Amendment Act is there's a bit of complexities there because it also intersects with the Public Service Amendment Act. The acting DG approved the appointment of a service provider, and the department is in the process of procuring the services of a legal consultant to assist the department to draft the regulations. What is important to note, especially with the PAMA regulations, is that when the minister makes regulations that apply to municipalities as well, it is required that the minister consults with the minister responsible for local government, the Minister of Finance, as well as organized local government, as well as where regulations will be applying to public entities. The minister is required to do so after consulting with the minister responsible for public entities. For the PAMA regulations, it's a bit difficult to give a specific timelines or specific dates. So it will take longer to process the PAMA regulations as opposed to the public service regulations. And also of importance is to note the minister's view that careful attention should be afforded when drafting the regulations to ensure a smooth transition, especially with regards to the devolution of powers, and also to ensure that there is no ambiguity during implementation. And that is the end of our presentation. Thank you.
I seem to have lost sound. Is it just me?
No,
No,
Chair,
lost.
this is the end of the presentation, the presenter said.
Apologies. I came. I had a bit of a technical issue on my side. Thank you very much, then, for the presentation. Members, that brings us then to the deliberation part of the presentation. Can we please have hands for so that we can have questions? Onward Kaba, I see your hand. Yes, Onward Kaba, you are welcome to go.
Chair,
Yes.
I don't know how to raise the hand. It's me. It's
Honorable
Pulwani.
Pulwani, I hear you. You can go after that, and then I'll see Honorable Space after that. Honorable Kaba, you were first. You can proceed.
Good morning, Chair. Good morning to our Minister and Deputy Minister, DG, honorable members, our support staff, and the department led by the DG. Honorable Chairperson, I think let me check my. Sorry, Honorable Chairperson. I don't know whether I open. Okay, open. Honorable Chairperson, let me welcome all the presentation from the CPSI and the department. Honorable Chair, let me start with actually, I have one question, Chair, in the CPSI regarding replication. Chairperson, given that the replication team can only serve 2 out of 60 plus annual projects, what operational strategy or institution framework is being designed to delegate replication responsibility to provincial OTP's online department. I thank you, Chairperson.
Thank you very much. Honorable Pulwane, you were second. Please go ahead.
Thank you very much, Chair. Let me join my colleague by appreciating all the presentations and also pass my greetings to the Minister and honorable members, our officials, our acting DG, everyone in the platform. Chair, mine is just, I've got few questions for public service. Maybe let me start with the public service regulation. My question is, what specific deliberation milestone the KPI and target completion date are attached to the contract for the external legal consultant to prevent the scope of crypt and project slippage? And then the next one is, what formal joint steering committee have been established with the COGTA, SALGA, and National Treasury to expedite the mandatory consultation required under Section 18, subsection 2. The next one is, how is the department handling transactional administration legal exposure in department attempting to implement the Amendment Act before the formal regulation are finalized and programmed? Maybe the last one, what technical mechanism will be provided to national, provincial, department, and municipality to verify their HR policies if it's aligned with the revised BSR and the PEM regulation before, or the regulation is once published? Maybe let me go to the CPSI. Chair, it's good to hear about this presentation. 120 million have been saved. And also we hear about the social innovation. The presenter spoke about the private hospital. I just want to check how many private hospital and public hospital are benefited, is the first question. The next one is, how does CPSI measure the impact of innovation beyond the number identified, particularly in terms of improving service delivery, cost saving, reducing waiting time, enhancing citizen satisfaction? The next one, what are the major barriers preventing innovative projects from being escalated up nationally, and what intervention had the CPSI introduced to address these challenges? The other one, is, what mechanisms are in place to ensure that innovative projects are not confined to individual institutions, but are integrated into government policies and standard operating procurement were appropriate? I think it's only this one. Yes. No, thank you, Chair. I'll stop there.
Thank you very much, Honorable Member. Honorable Space.
Thank you very much, Chair. Good morning. Excuse me, Chair. I have a very bad bout of flu. So I will just go through my questions very speedily. My first one is on the CPSI, and it's specifically referring to the slide that deals with the reduction in waiting times, where it highlights the reduction from about 75 to that. Chair, it's often it's easy, often to achieve success when one has pilot phase um, and to sustain it over a very long time. And so, my question to the CPSI is if they can actually tell us whether the reduction in waiting time has been maintained, and also explain what governance or monitoring and measures of accountability have been put in place to ensure that the innovation becomes a standard practice rather than depending on management or individual champions. The other one, Chair, is on the Broselow tape. The presenter stated that the tape saves approximately 4 minutes during pediatric resuscitation. What I would like to know is that if this innovation reduces the treatment delays during pediatric emergencies, why is it only being replicated in a limited number of facilities? And if possible, maybe is there anything that prevents it from being adopted as a standard practice in every public emergency unit and clinic that treats children? Then also, maybe I've missed that, but I think very important always is the value for money. And I need to understand if the CPSI has undertaken a cost benefit analysis to demonstrate that the lower cost of implementing this Broselow tape is indeed outweighed by reductions in medical errors, litigation, and also avoidable complications. My next question is to the DPSA. Gee, my apologies. My first one to the DPSA addresses the issue of accountability. And so, as Parliament Chair has fulfilled its constitutional responsibilities by us passing these acts, and that the President has assented to them, who is accountable for the delay in finalizing the regulations, and what consequences have there been for missing implementation timelines? And then this legislation in particular, Chair, is intended to strengthen the professionalism and the effectiveness of the public service. How has the delay in finalizing the regulations affected the ability of us as government to deliver on those objectives? And ultimately, what has been the impact on citizens? And then in terms of further future delays, what changes is the department making to ensure that future delays is accompanied by draft regulations during the legislative process so that the acts can be implemented immediately after promulgation rather than waiting months or years for regulations? Thank you.
Thank you very much, Honourable Space. Honourable Letlape.
I couldn't find my unmute button. Thank you, Chair. I think my questions are similar to what has been stated, but I'll probably state it differently. I welcome the presentations and well done, and it's good work that is being done. I just want to know from CPSI whether there is a mechanism to ensure that the improvements that are done on the service side are not lost. When you've done your project, like what was done at the hospital, in the pharmacy, does it then inform the norms and standards in that hospital? How is it then transmitted to being part of the norms and standards in our institutions? Do you also leave them with a tool where automatically waiting times become measured going forward, so we know whether they are regressing or not regressing? Because we see quite often that there's an intervention that comes in that improves service delivery. But as soon as it goes away, for whatever reason, the institution goes back to their default mode. What are the things that we have? And what are the tools that we're providing for continual performance management, so that we don't get back into the laps? And the same question would apply to the information that you've gathered in terms of cases that get withdrawn, etc., etc. How does that inform performance? Is there engagement with the police officials about the unacceptability of docket not in court? Are there consequences for those police? How do we ensure that the good work that you do continually improves services and it changes the system itself, so that those efficiencies are not lost? So for me, Office of Health Standards and Compliance, do you have agreements with the department in terms of how they ensure that this improves what they actually do, so that we can see a generalizable improvement in public service? And I commend the work that you do. We just want to make sure that what is being done is not lost and becomes what is expected and is measured going forward. Thank you, Chair.
Thank you very much, Honourable Member. Honourable Malinga.
Thank you, Chair. Greeting to Ndabezitha Shenge Siyachoba, Minister. The department led by the acting DG and the CPSI. Firstly, let's welcome the board presentation. And it appears that there's something that is happening. We really appreciate it. The first question, let me start with public service and administration. Just two questions. I just want to check that where are the legal practitioners who play the major role in the development of these important pieces of legislation? The second one, should the department not have developed the regulations simultaneously with the review of these two pieces of legislations? I think other questions my colleagues have covered me at CPSI. I don't want to be a broken record. Let me go straight to CPSI. The first one is that, what is the current national footprint of this innovation? In how many provinces, 2 hospitals or healthcare facilities has it been implemented since receiving the awards? And the second one is that, how many CPSI award-winning innovation has been successfully institutionalized and implemented nationally? And what lesson has been learned from those that were not successfully scaled up? The last one is that, what are the barriers preventing innovation projects from being scaled up nationally And what intervention has CPSI introduced to address since challenges? Let me stop there, Chair, so that by 12 o'clock, all of us will leave this meeting peacefully. Thank you.
Thank you very much, Honourable Member. That brings us to Honourable Mkunu as the last hand at the moment. Honourable Mkunu, please proceed.
Good morning, Honourable Chairperson and everyone in the meeting. Firstly, I would like to welcome all the presentations esiwathulelwe namhlanje. My first question here with CPSI. The CPSI reports that more than 18,000 learners and students have participated in its digital skills development programs over the past 5 years. And my question is, of more than 18,000 young people who participated in these programs, how many have secured permanent employment, internship, learnership, or successfully established businesses? And my second question is, okay, it's on monitoring and evaluation. The presentation showcases several successful innovation projects, but provides no evidence of long-term monitoring, sustainability, or independent evaluation of their impact. And the question is, what monitoring and evaluation frameworks does the CPSI use to measure the long-term impact, sustainability, and effectiveness of innovations after they have been implemented? I think my last question is, most of the innovation projects highlighted in the presentation were implemented in Gauteng, Mpumalanga, and the Free State, the Eastern Cape, Limpopo, with limited evidence of projects in other provinces. And the question is, what criteria does the CPSI use to determine which provinces benefit from innovation projects? And why do some provinces appear to receive significantly more support than others? Thank you. Thank you. Thank you so much.
Thank you very much, Honourable Member. As there are no other hands that I can detect, I think we can now hand over to, in the same order that the presentations was. Sorry, I hear somebody. I don't know if somebody was trying to unmute, but I will hand over to the CPSI first to give their feedback, and then after that the DPSA. CPSI.
Thank you so much, Chair, and thank you so much, honourable members, for the questions. I have in the meeting with me Ms. Gatliso Hamilton, who is leading our replication program, and I will ask her to come in to respond to some of the detailed questions. I've also got Mr. Muzin Tombela and Mr. Lindanium Tetwa, who are helping to drive projects. Mr. Ntombela is responsible for the digital transformation projects and also for the youth development program, and he can come in on those. And I have Mr. Nsizwa Dlamini, who is responsible for our case study development, which is the primary way in terms of our monitoring, evaluation, and learning initiatives. Chair, I'm going to try and group some of the questions together. I think one of the important matters raised by members is the incorporation of some of these solutions into SOPs, standard operating procedures. It's very important to note what our role is as an organization. I think members would know that we have no control over departments, and therefore our approach is to demonstrate the efficacy, the value of specific innovations. and then introduce those to the management, whether that's management at hospitals or departmental management then for further replication. Our primary role then is to make sure that the innovations actually do have impact, do have positive consequences. And as you know, with innovation, there's always the risk of unintended consequences. So when we replicate in a limited environment, we make sure that the claims that are linked to the specific innovation is indeed so, and that there are no unintended consequences. We further work with the willing and the able, because it's very important for these to be demand-driven for it to be sustainable. So, for example, the work in the clinic or in the pharmacy in Edenvale Hospital was entirely staff-driven. So it was not an external top-down introduction of a solution, but through co-design and through implementation, this was then automatically incorporated into the SOPs and into the approach for it to be sustainable. And as I've indicated, it actually triggered additional innovations. So for us, it is a problem to measure beyond implementation and to sustain, and for the simple reason of capacity. I've indicated already that our researcher, and we only have one, is in the meeting. So what we have agreed to do is to compile longitudinal case studies of solutions. So for example, with the e-recruitment from its inception in 2017 right through to the current, where we can track then the impact across the years and we can track the sustainability. That then also leads us in terms of addressing barriers and advising the respective executives in departments in terms of how to implement, because each project has its own barrier. It may be the lack of funding. Hence, I've indicated for projects where we've provided some seed funding, procured some laptops, procured some tablets. It may be a lack of willingness among staff, and then we provide training and change management solutions. It may be a simple culture of not wanting to change the status quo. And then we use the relevant tools in terms of taking it forward. Chair, in terms of the question around how do we take it to the various offices of the Premier, this is exactly what we are doing, and specifically for digital solutions, we are working very closely with the provincial CIOs so that we can identify relevant solutions in each and every of the provinces. We also work with our network, with the DPSA network of Patupile coordinators, and do make an effort so that these are shared across provinces. In terms of the Brosseler tape and the work done with provincial community safety, as well as the SOPs in general in the Department of Health and how many hospitals are involved in the various projects, I would, through you, Chair, request Ms. Hamilton to come in. And then in terms of the youth, perhaps for Mr. Ntombela to give some additional information. Again, I just want to emphasize that our mandate is limited in terms of our support for youth development, and therefore we are not monitoring directly the number of employment opportunities. But I'm sure Mr. Ntombela would be able to reflect on some of the evidence that we do have. Ms. Hamilton and Mr. Ntombela, if you can come in through your chair.
Yes, indeed.
Thank you very much, Honorable Chair, Honorable Minister, and members of the committee. My name is Khatiso Hamilton. I'll be responding on to the question that was asked by Honorable Member Polwane around how do we measure. So in hospitals, they have quality assurance officials who then measure, amongst others, all the waiting times and the different measurements that needs to take place in hospitals. But over and above that, within the pharmacy themselves, they will also measure their own service time so that they know how long it takes them to deliver the service that they're supposed to deliver. So we use those measurements that are there. And further on, when you look at the Speedy Q project, we worked very closely with the provincial departments, both in Gauteng and in Limpopo. In Gauteng, when you look at them, their provincial waiting time that they have set in the pharmacy for the entire province is just over an hour. And those are the times that we take into consideration. And that's how Edenvale Hospital was able to say we want to make sure that we reduce those waiting times, and they got to 9 minutes. And that work, it is being sustained. Hence, AED spoke about how they are now aiming to reduce that time further to 5 minutes. And to some extent, because we work very closely with them, they're already achieving that target of reducing those waiting times, and they're now sitting on an average of close to 5 minutes waiting time within the pharmacy space. And then the other question around the same project, which was asked by members Eleonora Spies around also the waiting time, is that these times have been sustained. So the project at Edenvale Hospital has been running for over 3 years, and over the time they've been reducing the time. So when this innovation entered for the CPSI Awards program, their waiting times were sitting at about 13 minutes, and they're constantly moving down and reducing on that time. So the project has been sustained. And what role we play as the CPSI is that as part of the replication project is that we then capacitate officials. Many a times, and we've seen it with the court watching brief, just to give an example, it was one official who self-taught themselves on how to do things. But as part of the replication project, we then capacitated the entire team in how to do this. And even when we then replicate to other provinces, we capacitate the entire team versus one person in the province, so that sustainability is guaranteed. And that also should explain, given the numbers that the AED reflected on in terms of our capacity constraint, it becomes difficult for us to take more sites or even more provinces, because it's a very intense and hand-holding exercise that we undertake during the replication project. And the other question that was asked, for example, in as far as the Broslo tape is concerned, we did it in 25 City of Tshwane facilities and 3 hospitals in Gauteng for both accident and emergency and the PEDS ward. And the 2 main challenges or results of this delayed resuscitation of babies will either be death or major damage, brain damage complications. And when we then checked in terms of litigation, how much it will be saving the hospitals or the institutions, it can be anything between 5 and 20 million per case. That will be the litigation cost linked to that. And I just wanted to also answer the issue around why so many provinces and not the other provinces. As part of the replication project, we then present to all the provinces, and we have those provinces that will raise their hands and other provinces will not raise their hands or show interest. And not that we give up on them, we do try and still engage with them to bring them on board. So for example, the court watching brief, we were fortunate that with that innovation, the former minister of SAPS had written to all the provinces to say what is being done in the Western Cape through the court watching brief. They would like to see that happening in other provinces. And unfortunately, only Eastern Cape, Northern Cape, and Northwest raised their hands, and those are the provinces that we were then able to support for replication. We are still in communication with the national office to say, can they assist so that we then bring along the other remaining provinces, since there was also that instruction internally from the national office. But in most cases, it's the lack of the buy-in from some of the departments or other provinces. Others move quicker than others, and that's where we find ourselves. I think I'll end it there. Thank you.
Thank you through you, Chair. Mr. Ntombela, if you would like to come in.
Thank you so much, Honorable Chair, Honorable Minister, and Honorable members. I hope I'm audible.
You are.
Yes, indeed.
All right. Thank you so much. Thank you. I really appreciate that. Chair, I will start with just echoing the sentiments that Mrs. Hamilton just shared. That I think as an institution, we are really stretched for resources. I am speaking to you now. We are sitting at the Office of the Chief Justice, and we are a mere team of 4, where we have 2 system developers and a business analyst and myself as the project lead. So we will always try our utmost best to give it our full, and ensure that we don't do just a tick box exercise. When we are at an institution or at a province, we always make sure that we listen to their request and align when replicating some of the solutions. So we are busy now with the e-recruitment solution that is being rolled out for the Office of the Chief Justice. So then I will go back then to the question around the youth, digital skills development for the youth. So when you look at the mandate of the organization, it's that of creating a culture of innovation, and we leverage on that, especially from the digital transformation side, to say, when we engage with these young people, for us, then it is very important to ensure that we entrench that culture. We get them to start thinking creatively. We get them to start building solutions for impact. That is why you would find the CPSI across the 12 months that we would have been participating in no less than 12 hackathons in a year. And we don't do that just for a tick box exercise. We go there, we interact with the young people, and we share the insights of the workings of government. When Mrs. Hamilton is busy at the Department of Health, we take the learnings from there, so that when we come back to these young people, we share those insights to say, no, but when you're dealing with Department of Health, this is what you need to consider. These are the type of pain points that are there. And we get them then to really use the skills that they would have acquired from their different institutions. Some of them are even self-taught, but we just spend time with them and ensure that we shape the solutions, we shape their thinking, because we are trying to create problem solvers of the future. And some of them, we nudge them to even consider government as an employer of choice. From my side at the CPSI, I've poached 2 already from hackathons that I had identified at hackathon. The one has since left for a senior position at the information regulator. I'm left with the one now, who again, it's a talent that we saw from these gatherings that we put together for young people. There is a team that won the hackathon that the CPSI had arranged in 2022. 3 young ladies from UJ. Discovery Bank snatched them up immediately after they saw how well they did at that particular event. So for us, then it's not just about the culture only, but also creating that environment for the young people, that enabling environment to put them together and share some of the challenges, and then also work with them in putting together some of the solutions that they come up at these hackathons. And someone may ask, but what of importance is a hackathon? And I always make reference to look at the scooters that you see around from Checker 660. That is a program that the CPSI is involved in, the FNB hackathon and the FNB App of the Year. We are heavily involved in that as the CPSI. When you look at naked insurance, that's an idea that came from a hackathon, solution developed in a hackathon. When you look at easy equities, so those are the type of young people that we get to spend time with, get to help shape solutions and get them to either be ready for the market or ready for government. So it's unfortunate that not all of them will end up in the employ, but some of them, they end up as SMMEs. Some of them then end up in the private sector. And fortunately, like I said, the CPSI has had 2 of them already employed, and 1 has since left. Thank you so much for the opportunity. I stop here. Thank you, Chair.
Thank you, Mr. Ntombela. Chair, there are quite a couple of questions that talk to the provincial reach of the CPSI. I just want to indicate to members that we are very well aware of that, but it is unfortunately also a cost-related issue. As indicated, this team need to spend a couple of weeks with a province or with institutions to make sure that projects are implemented sustainably, to co-design, to customize, etc. And unfortunately, in terms of cost, there is a limitation in terms of what we can do. But Chair, there was one very important aspect that was raised by Honorable Malinga, and that is lessons from failures, and by a number of members in terms of barriers. And I just want to conclude to focus on that. We do analyze this also from a global best practice and from a theoretical perspective. And it is indeed very important for us to learn from failures. And we analyze these at both individual, organization, and systems level, because they vary from solution to solution, different failures. But we see some common trends, most importantly, ownership, secondly, capacity, and then leadership support and the incorporation of this innovation into SOPs, into APPs, annual performance plans, into strategic plans. In our approach in terms of reducing then, in terms of the lessons, we focus on 3 areas. One is analyzing the associated risks, also the risk of unintended consequences, and ensure that those are mitigated. We focus on providing agency, both for innovators as well as for departments in various manners. And then lastly, by analyzing the environment for experimentation and implementation. Sometimes there's a policy inhibition, sometimes it's a resource inhibition, or sometimes it's just a knowledge deficit that needs to be addressed, and these are then addressed accordingly. So we do look at lessons from failure. We have projects that were running for 5 years, and by applying the lessons that we have learned from that, we were able to introduce then agile steps that, for example, enabled us to support Mpumalanga within a period of 2 months. So we are slowly but surely getting better in terms of capacity, but also in terms of our approach to innovation. Chair, I think there are a couple of the questions that will also be answered in the additional narrative report. But for the sake of time, let me pause there. Thank you.
Thank you very much indeed to all the speakers of the and that gave feedback from the CPSI. We now hand over to the DPSA.
Thank you very much, Honorable Chair. Well appreciated all the questions raised. I'm not a robot. Let me confirm that, Chair, as you've sent the rules already. We're in the AI environment these days. You may think a person is behind the computer while the computer is talking. Thank you very much, Chair. There are fundamental questions raised by honorable members. Starting with the very first question by Honorable Member Bolwan on the issue of KPI and target. I can respectfully respond to say, Honorable Member, we do have what you call the service level agreement to put time frames, and what we did there, we have to squeeze the time frame to address few issues, from drafting to consultation and approval. All those three steps have got their own targets and the requirements by year, and as members knows that regulations are widely consulted. So we'll do the same in that regard as part of the interventions. So Honorable Member further raised a question in terms of the former Joint Steering Committee with the affected departments, like we are DCOG, you are SALGA, you are Treasury. Yes, indeed, I can confirm, Honorable Chair, that we do have a standing committee. The members will recall that sometime we came to Parliament to represent the Central Register while on the drafting stage, the same with the regulations. That register by that time requires that there must be concurrent from Minister of Finance and Minister of COGTA. So at that time already we put a structure, hence Central Register was approved, regulations were signed off by the ministers, they are now in operation, they've been proclaimed in terms of the operation of the Central Register. So that structure, Honorable Pulwane, will form part of the discussion to finalize the regulations. As you are aware that the PAMA talks about local government, which entrenches the role of COGTA in local authorities. There was a question raised by Honorable Pulwane again on the issue of how do we handle transactional processes, the window. Yes, indeed, communication is going on. I am the chairperson of GISC cluster, which is the structure of DGs. We do communicate with DGs. Secondly, I'm a member of FOSAT, chaired by the DG presidency. There are some discussion at that level. And even today, we'll issue a circular just to strengthen and emphasize the messaging on how far we are, and therefore the window period as the law requirements. When the law gets assented, there's a window. Every law is like that. Some windows are too long, but some others are too short. But we must make sure that ours become short. But in the next few, I cannot commit now, but you listen to Advocate Maschaba. We'll come back to Parliament just to share with you at the draft level so that you can also give input, members. Again, on the issue of information, the DPSA established a structure called Heads of Corporate Services. This is the structure of all the HR in the public service. All 100-something departments, we do meet DPSA head structure. Because these laws do affect the operation within the HR employment, so we do engage and we present in terms of development and to get input from our HR colleagues across government. Honorable Speaker asked a question of the missing timelines and out the delay. There's no timelines that have been missed. As I've indicated, when the law gets assented, there's a window for clearing to be done. As I've indicated, other windows are too long. It depends in terms of the readiness. So we want to be ready, as you've listened to what Minister, so that we can go back to the president and share with him our product and output. And then from that basis, he can issue a proclamation. So we will do that, honorable members, as part of our work. The future plans, I agree, honorable speakers, on the future plans. On the future plans, we are currently reviewing the structure of the department. I think this question is also in line with what Honorable Malinga raised, that I'll do that right now. The future plans, we are reviewing the structure of the department. There are a few gaps. Of course, you might have seen members when they come to Parliament. So we want to create permanency in those two gaps. Now, if I jump to what Honorable Malinga raised, when he said, where are the legal practitioners? Fair question. We have lost 3 key senior people. One, we've lost the head of HR, which joined Treasury. When we came to Parliament to present the instruction bill, she was leading Treasury delegation. I think members may know the person. We have lost a director who have went and opened his private practice, a law firm. We have lost a deputy director. We have joined the state law advisors. So we have lost 3 key individuals within the legal space. As Honorable Malinga raised that question to say, where are those practitioners? Now, in terms of what Honorable Malinga says on the regulation development, as I've indicated to say, yes, indeed, when we lost those people, I think there was a vacuum. And then we've got Advocate Maschava, who have just joined, and they have taken the baton in that regard. I'm assisting to capacitate that. Hence, I said, let's also bring in the expertise from outside to move with speed, because we do have a lot of vacuum within our legal department. I think I've covered all the questions, but I have to head over to Advocate Maschava if there is any further question left. Advocate Maschava, you may proceed. Thank you very much, Honorable Chair.
Thank you, Acting DG. I think you covered everything that I wrote down. Yes, thank you.
Thank you very much, Honorable Chair. We submit.
Thank you very much indeed, Acting DG Pukela, and your team at the DPSA. Members, if there are no further questions or hands, I think we can excuse the DPSA and the CPSI while we move to the minutes. I don't see any other hands. Okay. I think, members, we can then move on to the last part of the agenda. And I would just like to thank the DPSA and the CPSI for the attendance, and you are welcome to sign off. The committee will now just deal with internal minutes that need to be approved.
Thank you very much, Honorable Chair. Well appreciated.
Thank you, sir. Okay, members, there we have it. We move on to the last part of our agenda, the minutes. Masi, can I hand over to you to just flight the minutes and take us through it, please?
Good morning, Chairperson, and good morning to honorable members and colleagues. Chair, we only have 3 sets of minutes today. I will go through them quickly, Chair. I'm already on the minutes of the 29th of April. The same minutes were sent last week, Chair, to honorable members. I'm on page 1. These were just adoption. I'm on page 1, Chair. Page 2. And that's page 3. The discussion of these of the sitting were incorporated into the report. These are the minutes of the 29th April. Thank you.
Thank you very much, members. There you have it. Minutes for 29 April. Can I please see a proposer and a seconder for the adoption of the minutes? Honorable Kaba.
Thank you very much, Chair. I rise to adopt the minute.
Thank you indeed, member. Any other, can a member please second? Honorable Malinga.
Thank you, Chair. I second.
Thank you very much indeed, Honorable Malinga. Masi, we can move on to the next set of minutes, please.
Thank you, Chair. Same as the previous one, Chair. We were just adopting here, Chair, the reports. I'm on page 1. These are the minutes of the 6th May, 2026. On page 2, Chair. On page 3, the same, the discussion we're on the report. That's page 4, Chair. These are the minutes of May, Chair. Thank you.
Thank you very much, members. Those are the minutes for the 6th of May. If I could please see a proposer and a seconder for the adoption of the minutes.
I move, Chair, for the adoption of the minutes.
Thank you, Honorable Pulwane. Honorable Space.
I second the adoption of the minutes.
Thank you very much. The minutes, this set of minutes and the previous set of minutes have both been duly adopted. We can now move on to the final set of minutes.
Yes, indeed, Chairperson. These are the minutes of the 13th May, 2026. I'm on page 1. Page 1, Chair. I'm on page 2. I'm on page 3, Chair. These are the minutes of 13 May, Chair. Thank you. Thank you so much.
Thank you so much for your assistance, Committee Secretary. Members, proposals and seconders for the minutes of the 13th of May, please. Honorable Kaba, I see your hand. Please proceed.
Yes, Chair, I move the adoption of the minute. Thank you, Chair.
Thank you so much. Can I please have a seconder?
I second, Chair.
Thank you very much, Honorable Pulwane. With that, the minutes have been duly adopted. Masi, can you please just confirm that concludes all of the minutes which we had to deal with today?
Yes, Chairperson.
Wonderful. Members, thank you very much for today's session. You were very disciplined and professional as usual. I wish all members good luck with all of the different constituency work that we have to do as well. And I look forward to seeing members in our next physical meeting. But good luck to everybody with the work that is ahead. And thank you for the support, Masi and your team. And with that, members, the meeting is adjourned. Thank you very much.
Thank you, Chairperson.
Thank